Hello, how are you?
Hi, good, thanks.
Okay, so Dr. Simoni wants you to have the colonoscopy, and the prep that he chose was the Suprep. Okay? So just like any colonoscopy, 5 days prior, you're going to stop any aspirin, Coumadin, blood thinners. Okay? That includes any ibuprofen, Aleve, Excedrin, Coumadin, and Advil. That includes any multivitamins with iron or fish oil. But Tylenol is okay if you need it for pain. Okay? Also, if you do smoke, you're going to stop that 5 days prior as well. Okay? If you're taking Coumadin or any blood thinners, have diabetes, or have been instructed not to stop your medications by your physician, contact our office to determine the dose schedule. 2 days before your procedure, you want to hydrate yourself as much as you can. Okay, so you're going to drink 8-ounce glasses of water, okay, throughout the day. The day before the procedure, you're going to be on a clear liquid diet the entire day. That includes any water, apple juice, Sprite, Gatorade, anything yellow or clear. You can have chicken broth, beef broth, vegetable broth. If you feel like munching on something, you can have popsicles or Jell-O, but only the yellow kind. Nothing with milk, pulp, or dyes. No solid foods of any kind, clear liquids only. Make sure you do not fast. Drink 64 ounces of water aside from the liquids taken during meals. So the Suprep, it comes with 2 bottles and 1 cup. Okay, so the day before the procedure at 6 p.m., you're going to pour 1 bottle into the cup. You're going to add 10 ounces of water, which pretty much fills up the cup. You're going to drink that entire thing, and once you do complete that, you're going to drink 2 full glasses of water within the next hour. Okay? You may resume your clear liquids after that, but it's nothing to eat or drink after midnight the night before. 5 hours before your arrival time of your colonoscopy, start drinking the second portion of the prep. Repeat steps 1 through 4 using this other 6-ounce bottle in the kit. If a biopsy is performed, do not take any aspirin products for 7 days to lessen the risk of bleeding. Diabetic patients, do not take your diabetes pills today, the day of your procedure, but bring a dose with you and to snack after your colonoscopy. Do not operate heavy machinery, make any important decisions, or purchase any major items throughout the rest of the day. Make sure to drink 8-ounce glasses of water to flush out any remaining prep solution out of your bowel. The doctor will talk to you after the exam and will give you recommendations for diet, medications, and follow-up care. You may receive 4 separate bills from us. 1 from us, the physician, the facility, the anesthesiologist, and the pathologist if he does do a biopsy. Okay, and the doctor will be right in to answer any of your questions.
Hi,
Hi.
how's it going? So I heard that you had some questions to ask me?
Yes, I do.
All right, excellent.
What is a colonoscopy?
A colonoscopy is an exam where I use a flexible, thin, lighted tube that I advance it throughout your colon to see a magnified image of the lining of your colon.
When is it used?
Well, it's used for many different reasons, but the most common reason why we do a colonoscopy is for patients after age of 50 to detect colon cancer and prevent colon cancer. The frequency of which colonoscopy should be done depends on what we find on the initial exam. Generally, that's about 3 to 5 years. You may hear that colonoscopy follow-up should be done every 10 years or so. That's usually promoted by your insurance company. The truth of the matter is that no matter how good of a colonoscopy somebody is, there's about 1% chance of missing tiny polyps. Those polyps can actually turn into cancer in a 10-year period. So 10 years could be a little bit of too long of a frequency that we would have to wait. All right? There are other reasons why we do colonoscopy is to find out what's wrong with patients. Sometimes you may have abdominal pain or changing bowel habits, and we do colonoscopy to find out what's wrong. And that helps me formulate some kind of treatment plan. Sometimes we do colonoscopy in the younger patient population than 50 years of age, such as when patients have either family history of colon cancer or they have other conditions that put them at risk of colon cancer. So it can be done at any age for those reasons. All right?
What happens during the procedure?
The procedure is done either in the hospital or in an endoscopy center. All right? When you arrive to the center, the nursing staff will take you in. They monitor your vitals. They check your blood pressure, your oxygen saturation, your heart rate, temperature, all that stuff. And they put a small intravenous catheter through your vein, through which I give you sedation, or an anesthesiologist can give you anesthetic. The safest and best way to have this procedure done is with an anesthesiologist who gives you medication to go to sleep. But if you have a certain insurance plan, they don't accept to pay the anesthesiologist. So the only option that you will have is for me to give you some sedatives, which may or may not make you completely go to sleep. All right? If you would like the anesthesiologist to be there and help, you may want to make other arrangements with them. All right? Either with the physician anesthesiologist or the anesthesiology group. You can also visit a website that gives you more information about this. It's called www.sedationfacts.org.
What happens after the procedure?
Generally, after the procedure, you feel fine. But sometimes you may have a little bit of cramping or abdominal discomfort, which has to do with the air that we put in the colon. This air can be passed very easily right after the procedure. The sooner you pass the air, the better you'll feel. All right, that's the most common thing that happens with patients after the procedure. You will also be kept in the recovery area after the colonoscopy, which, by the way, lasts about 15 to 20 minutes until you're able to walk and go home. Although you're going to feel fine, you are not allowed to operate any heavy machinery, drive, or do any exercises. All right, that's why we have somebody drive you home. All right, once you get home, we recommend that you drink lots of fluids, and you should be able to eat a normal diet afterwards. If you have a lot of abdominal pain, cramping, or you have any bleeding, I want you to call me right away, or go to the nearest emergency room and have the ER physician call me right away. All right?
What are the risks of the procedure?
The most common things that can happen after colonoscopy, as I mentioned, could be some abdominal cramping or some bruising at the IV site, or minor bleeding if we do any biopsies. All right? But risks of not doing a colonoscopy is far more common than having any of the complications that can happen. All right? There are some other serious complications that can happen during a colonoscopy, but they are extremely rare, and they are all outlined in your consent form that you can review. All right? Any other questions? All right. Well, if you think of any other questions, or you have some questions that haven't been answered, I will see you before we start the procedure, and you're more than welcome to ask me any concerns or questions you may have. All right? Excellent. Why don't you come on out? We'll get you all set up, okay? All right. After you.